Hi again. My name is Dr. Raghavan, and today I'm here to talk a little bit about airway disordered breathing or sleep disordered breathing, of which sleep apnea, which is the more commonly heard term, is a large part. So, I have always believed that dentistry is an integral part of medicine, that we cannot practice a well rounded dentistry without having a sound knowledge and background in medicine. And that is how I have always approached my patient care, like getting a thorough history. What medications are the patients on? How can we help integrate dentistry as a part of the entire body? So one of the things that I have observed along the course of my career is that a lot of my patients were experiencing clenching and grinding issues. And commonly when we hear about these things, it always gets swept under the rug in the name of stress. And whether we like it or not, stress is a part of all of our lives. So it's not true that all of us are clenching and grinding. Why is there a higher incidence of clenching and grinding in some people? These people predominantly presented with a lot of wear on their teeth, broken fillings and crowns, needing more dental work. So that was how I first got into the realm of airway disordered breathing. I also observed that a lot of these patients had a harder time tolerating dental appointments, whether they felt like they just couldn't breathe in the middle of dental work, or they had trouble sitting for a procedure. They also had a more elevated position of their tongue. So as a part of our regular screening process, we started recording the tongue position, which we call as Mutlam-Patty classification, which is basically the position of the tongue in the mouth against the rest of the airway or the soft palate. And I started noticing that there was more correlation of certain subtypes to the clenching and the grinding process. So I wanted to find the missing piece of the puzzle. I just didn't feel happy about sweeping it under the rug of stress. As I looked more into it, that's when I found out about airway disordered breathing. And the more I learned about airway disordered breathing, the more I got trained in it, I realized that there was a whole segment of medicine that I didn't know before. And that's when I decided that I needed to make this a part of our practice and that I needed to specialize in this. So obstructive sleep apnea, which is the most common term amongst the spectrum of airway disordered breathing or sleep disordered breathing, is more commonly heard of than most others. But that is not the only thing that falls under the airway disordered breathing. About 20% of adults actually have some form of airway disordered breathing, including sleep apnea, and about 80% of these people go undiagnosed throughout their life. So what is airway disordered breathing, or what is sleep disordered breathing? Why is it called as sleep apnea? Airway disordered breathing is any obstruction or any barrier to getting adequate oxygen to the brain so that the brain can restfully wind down at night, allowing the rest of the body to actually take a break and get some rest, which is very critical. Just like we say during workouts that rest days are just as important, the body actually needs a good 7 to 7.5 hours of peaceful rest time, and that includes the brain, because some of the most critical hormones that are needed for a good functioning body for the next day actually get secreted at the time of that sleep, which ideally should be about 7 to 7.5 hours every night. But are all of us getting a restful night's sleep? That is the question. So what happens when these airway disordered breathing issues go undiagnosed? When our body is actually day after day overloaded and not getting the adequate sleep that it needs to get because of a deficiency in the oxygen that is reaching the brain, it comes back over the years as lifestyle related diseases, high blood pressure, heart issues, stroke, obesity, because when we are not getting the restful sleep and our brain's not getting the rest, it refuses to release some of the most critical hormones which are necessary for making healthy choices or for having the energy to be able to work out. It comes back in kids as childhood obesity. It comes back as ADHD issues or behavioral problems because the chemical balance in the brain is interrupted because it's not being able to get the right amount of oxygen and consequently the right amount of rest that is necessary. It comes back as learning disorders, even in adults, loss of memory. So there is a long list of things that airway disordered breathing can cause. So it's imperative that if you or a loved one you think might benefit from taking a deeper look into seeing if they have an airway disordered breathing issue, that we take the first step to see how we can get help to fix the same. Hope that was informative, and we will see you soon with another informative video.